Great. Can everybody hear me okay? Great. In the back? Okay. Oh, you can hear but not see. Perfect. Okay. Thank you, Erin. So my name is Elise Ladouceur, and I'm a staff pathologist at the Joint Pathology Center. Today I'll be talking about hepatopancreatic lesions. That's the closest that horseshoe crabs have to a liver, so I thought it was appropriate for this conference. My collaborators on this project and abstract are Dr. Cardicetti from National Zoo and Dr. Mangus from Johns Hopkins. So first, I'll just give a brief overview of horseshoe crabs. Then I'll talk about the study that my collaborators and I are doing, and specifically the hepatopancreatic findings. So horseshoe crabs are arthropods. For those of you that don't know, that means they have segmented appendages, an exoskeleton, and striated and smooth muscle. They fall into subphylum Chelicerata, and all of the chelicerate arthropods have a body that's divided into the prosoma, which is the front part of the body, also known as the cephalothorax, and the opistosoma, which is the back part of the body, also known as the abdomen. And this is the tail or telson. And chelicerate arthropods include horseshoe crabs, as well as spiders, scorpions, mites, and the like. The Atlantic horseshoe crab lives in the Atlantic Ocean, as well as the Gulf of Mexico. Normally, they live in relatively shallow waters, but once a year, they come onto sandy beaches for spawning in droves. They're relatively long-lived animals, up to 40 years. There are many threats to the wild populations, but the one that I'll talk about briefly today is collection of these animals for their hemolymph. So every year, masses of horseshoe crabs are collected during spawning to bleed them to harvest their hemolymph. Their hemolymph contains an enzyme called linulus amoebocyte lysate that reacts with very small quantities of endotoxin. And due to that property, the FDA requires that nearly all biopharmaceutical products that are released to market are tested with horseshoe crab hemolymph for endotoxin contamination. So drugs or vaccines that you've received have probably been tested with horseshoe crab hemolymph. And in this image, the opistosoma has been bent backwards, and then a needle is placed into their arthrodial membrane, which is between their prosoma and the opistosoma, directly into their heart, and that bleeds their hemolymph, which is blue. This is a drawing from an incredible necropsy dissection guide done by Katie Bergdale, who's a medical illustrator, graduated from Johns Hopkins. So to orient you to their anatomy, ventrally placed, this is the mouth, which leads to the foregut and then hindgut. Surrounding the mouth, this orange organ is called the coxal gland, which is analogous to the kidney. Dorsal to that is the brain. Most dorsal in this area, in this animal, is the heart. And again, this is where the needle went through the arthrodial membrane to bleed these animals. The gills are ventrocaudally placed. And then the remainder of the coelomic cavity is filled with this orange tissue that surrounds all the other organs, and that's the hepatopancreas. This is a table that I've compiled of the list of organs to evaluate when looking at these animals histologically. And the reason that I've put up this table is to underscore the importance of knowing normal anatomy in invertebrates. They have some pretty different organs to our vertebrate counterparts. So today we'll talk about the hepatopancreas. There's two main cell types or structures in the hepatopancreas. One are the interstitial cells, and those are analogous to the hepatocytes. The other are the collecting tubules, which are branches off of the gut, and those are more analogous to the pancreas. This is a histologic image of the hepatopancreas. So the majority of the tissue are these brightly eosinophilic cells. Those are the interstitial cells, again, analogous to hepatocytes. These are storage cells, so they store lipids, proteins, glycogen, and the like. And then these tubules here are the collecting tubules. So again, these are branches off of the gut, and they release enzymes during ingestion, similar to the pancreas. In addition to surrounding most of the organs and the rest of the coelom, the hepatopancreas also interdigitates with the gonads and with some skeletal muscle. Does anyone know what sex this animal is? Female. Great. Sure is. So this is higher magnification. So the interstitial cells are these big polygonal cells with brightly eosinophilic granules that again are storage cells. They're also called reserve cells. And here are the collecting tubules. They have a simple columnar epithelium that's composed primarily of two cell types. One of the cell types are called dark cells. And I don't know if you can see in the back, but they have these brightly eosinophilic secretory granules that are called zymogen granules. And those have trypsin, amylase, lipase. So when the animal ingests things, these are released into the lumen, which is a branch of the gut. The remainder of the cells are called light cells, and those ingest fine food particles and phagocytose them. So this is a collaborative study done with Johns Hopkins and National Zoo. So we looked at cases of Atlantic horseshoe crabs that had been submitted for necropsy and came up with 66 cases. We reviewed the history, gross findings, as well as the glass for all of them. So today I'll be talking about the findings that we identified in the hepatopancreas. Before getting into the hepatopancreatic lesions, I'm just going to briefly cover the basic immune response of a horseshoe crab to help orient you to the lesions. So under normal physiologic conditions, hemocytes are the only inflammatory cell of horseshoe crabs. So that keeps morphs pretty simple. So under normal physiologic conditions, these are round cells with abundant eosinophilic granules in them. And these granules have antimicrobial factors that activate clotting, agglutinins. And under pathologic conditions, these hemocytes aggregate around wounds, any infectious agents, and foreign material, and then they release their granules. And that release of granules activates something called coagulin, which leads to formation of an insoluble gel called a coagulum. And that coagulum then occludes the wound, entraps and isolates the foreign body or the infectious agent, and also serves as a milieu for the hemocyte granule contents. So this is a histologic image of a typical hemocyte coagulum. So on the left, this area is granular hemocytes. So these are hemocytes that are infiltrating into an area that have not discharged their granules yet. In the center, I call these agranular hemocytes. I'm not sure if that's an official term, but that's what I refer to them as. So these are granules that these are hemocytes that have already discharged their granules, which leads to formation of this coagulum. So this would be the center of the inflammatory coagulum, and then this would be more peripheral. These are the primary diagnoses of our study. So we found a number of infectious agents, bacteria, fungi, parasites, as well as sometimes inflammation without an evident infection. And then sometimes the interstitial cells had decreased eosinophilic granules, and the dark cells in the collecting tubules had decreased zymogen granules, which I'll talk about a bit more. So this image is a typical bacterial hemocytic coagulum. For orientation, you have some interstitial cells out here, but most of this is effaced by the coagulum. So around the outside, you have abundant infiltrating granular hemocytes. Then centripetally, right around the coagulum, the hemocytes no longer have their granules. And then centrally is this coagulum that has some entrapped bacteria. This is a substantially larger hemocyte coagulum. So for orientation, these are collecting tubules, and this is the interstitial. These are the interstitial cells. Around the outside are hemocytes infiltrating, and then a large coagulum with entrapped bacteria. This would represent the body wall here, and it's hard to appreciate, but there are actually fungal hyphae infiltrating here. And when we saw fungi infiltrating, it was usually due to cutaneous ulceration, so an outside-in process, where when we saw bacterial granulomas, it was frequently multifocal in the hepatopancreas, similar to what you would expect for sepsis in a vertebrate. Additionally, we frequently identified trematodes in various stages of degeneration, and these were reviewed by a parasitologist who tentatively identified them as Microphilus limulus, which is a digenetic trematode that's present in almost every wild one-year-old horseshoe crab. And so in the young animals, they tend to be a little bit better preserved. They have this double wall and globular contents, and sometimes you can see a sucker. In older animals, they're usually a little bit more degenerate. Generally, these have next to no inflammatory response associated with them, but every once in a while we saw a few hemocytes infiltrating. These are all hepatopancreas, these three, and this one is actually in the submucosa. These parasites can infiltrate essentially any connective tissue. So this is the hepatopancreas. These are actually gonads. Can anyone tell me what sex this animal is? Male. Great job. Okay, so I'm going to focus now on the interstitial cells. So on the left is a presumptively normal hepatopancreas from a horseshoe crab, and it's reported that in well-fed animals, these interstitial cells have abundant eosinophilic granules. And it's also reported that in starved horseshoe crabs, those granules are substantially depleted. So arthropods don't have any gross or histologic adipose stores, and as these are the storage cells of these animals, I'm presuming that this might be a way that we can evaluate the nutritional status of these animals, and so I would consider this animal in decreased nutritional status and this one in excellent nutritional status. A confounding factor is that there is some variation in the number of eosinophilic granules based on the location of the hepatopancreas. So the hepatopancreas around the gut has abundant eosinophilic granules, and around the brain, for example, has slightly less. This is the last histologic finding I'll talk about. So this is a collecting tubule. Here's another collecting tubule, and you can see here that the dark cells have abundant zymogen granules. And then on the right, you can see that these zymogen granules are really replete. You probably can't even see them in the back. They're so few in number. And I'm not sure why there's zymogen granule depletion in some of these cases. One possibility is that it's analogous to what we see in some invertebrates, where zymogen granule depletion is indicative of decreased nutritional status. Additionally, I'm sure maybe this animal is just recently postprandial and has released the zymogen granules into the lumen. I'm not sure about that.
That's a question.
Yeah.
Are the granules in the interstitial cells PAS positive?
I don't know. I could look at we have a number of them that have had special stains on them, and a lot of them have had PAS done because there's fungal infections commonly, so I could look and get back to you.
Glycogen, those little granules, and they clear with diastase, and give you some idea of their energy storage.
Right, and I haven't done that study, but ultrastructurally, they've looked to say that this has the correlation to loss of these correlates to decreased glycogen by EM. So inclusion infections were pretty common. In some of the animals with fungal infection, it was frequently PCR'd as fusarium. The bacteria, when gram staining was performed, was often gram negative, and the parasites were presumptively diagnosed as Microphilus linealis. As I stated earlier, I'm unsure of the exact cause for the decrease in eosinophilic granules in interstitial cells. Published reports say this might correlate to decreased nutritional status, and the decreased zymogen granules in the dark cells may just represent a normal physiologic state postprandially, or may also have some indication on nutritional status. I'd like to thank Lee Clayton and Jill Arnold of the National Aquarium in Baltimore, as well as Katie Bergdale, who is the medical illustrator that put together the Horseshoe Crab Dissection Guide, and my collaborators on this presentation, Dr. Cardacetti of National Zoo and Dr. Mangus from Johns Hopkins. And that was an excellent response. I heard a lot of ohs. I put this up for Bruce to show that invertebrates can be cute even though they don't have fur. Thank you.